Prior authorization places burden on cancer patients and delays care, according to a study presented at ASCO Quality Care Symposium 2025.
When someone is diagnosed with cancer, every day matters. Treatments are carefully planned by the oncology team to give patients the best chance at recovery. But there is a growing obstacle in cancer care that many people don't see coming: prior authorization. Prior authorization is when an insurance company requires approval before a doctor can order a medication, imaging test, or treatment. The idea behind it is to control costs and prevent unnecessary care. But for cancer patients, it often leads to delays, stress, and financial problems. A new study presented at the 2025 American Society of Clinical Oncology, ASCO, Quality Care Symposium looked at how prior authorization impacts real patients. Researchers surveyed more than 1,000 adults with cancer from across the United States. Here's what they found. 3 out of 4 cancer patients had to go through at least one prior authorization between 2022 and 2024. In half of those cases, patients or family members had to get involved, making phone calls, submitting paperwork, and arguing for approval. Many lost hours, even full workdays, just trying to get the care their doctors had already ordered. Some patients spent 8 hours on a single prior authorization, others spent up to 24 hours, and a group spent over 40 hours. That's a full work week just to get approval. The study found that some groups struggled more. Patients under 65 with employer or Medicare insurance, patients with advanced cancer, men, who were twice as likely as women to be pulled into the process, and the consequences were serious: more treatment delays, more financial stress, worse emotional health, patients skipping medications because of cost. Doctors have long believed that prior authorization causes real harm. This study finally showed the numbers. A second study from Vanderbilt University looked at radiation therapy. Over 90% of radiation oncologists reported delays because of prior authorization. More than half said delays lasted 5 days or longer. 30% saw major medical complications. 7% linked these delays to patient deaths. 58% had to change or cancel treatments that were supported by national cancer guidelines. When life-saving treatments are delayed, outcomes suffer. For a cancer patient, a delay isn't just an inconvenience. Cancer does not pause. When treatment starts late, tumors can grow, pain can worsen, and survival can be affected. On top of that, patients and families already carry emotional and financial stress. Adding hours of phone calls and paperwork makes the journey even harder. As one ASCO expert said, prior authorization isn't just paperwork. It becomes a second job for patients. If your insurance requires prior authorization, here are steps that help. Ask your oncology team early if your treatment needs insurance approval. Keep notes, dates, names, and reference numbers during calls. Appeal denials. Many approvals are granted after appeal. Ask for help. Social workers and financial navigators can support you. Speak up. Delays are important to report to your healthcare team. Prior authorization was meant to control costs, not delay life-saving care. But for too many cancer patients, it has become a barrier, costing time, money, and emotional well-being. Reforming this system would speed up treatment, prevent avoidable complications, reduce stress, save lives. If you or someone you love is facing treatment delays, talk to your oncology team. You are not alone, and your care matters.